What is robotic surgery? What are the types of surgeries that can be done with a robot? What happens during a robotic surgery? What are the advantages and disadvantages of robotic surgery? I'm Dr. Dakshitha Wickramasinghe, and let's talk about robotic surgery in this video. Surgery has evolved in leaps and bounds over the past few centuries. Surgery that was performed as open surgery were performed as laparoscopic surgery in the last part of the 20th century. Robotic surgery is the next step of this evolution. It uses a device known as a surgical robot to conduct surgery inside your body. This robot has three main components. The first is a set of arms which have surgical instruments. These are introduced into your body to perform the surgery. Second is a camera which has high-definition images and three-dimensional vision. Third is the console where the surgeon sits and performs the surgery. When we think about surgical robots and robotic surgery, there are many myths. One of the biggest myths is that a robot performs your surgery by itself. Nothing could be further from the truth. This is only in sci-fi movies. The surgical robot is controlled continuously during your procedure by your surgeon. Many types of surgery can be performed as robotic surgery. Any surgical procedure previously performed as open or laparoscopic surgery can be performed as robotic. In addition, certain procedures which could not be performed laparoscopically can be done via a robot. These include certain hernias and certain cancers in the pelvis. In addition, gynecological surgery, thoracic surgery, and cardiac surgery or heart surgery can also be performed with a robot. The actual surgery that happens inside your body is very similar to what would happen during open and laparoscopic surgery. What is different are a few steps before the procedure starts. Just like laparoscopic surgery, your surgeon will make a few cuts in your belly to insert ports. These are tubes which allow the instruments of the robot to go inside your tummy. Through one of these ports, the robot also inserts the camera. This camera provides the view that is necessary for the surgeon to see what's wrong and to conduct the surgery. Once the instruments are placed, the surgeon sits at the surgical console and performs the surgery. There may be an assistant surgeon staying close to the patient to help with this procedure. Robotic surgery has several advantages. All of the advantages of laparoscopic or minimal access surgery are there in robotic surgery. For example, there are smaller cuts, meaning it takes less time to heal, less scars are formed, less infection of those wounds, less time spent in hospital, and earlier return to your normal work. In addition, the robot has several other advantages. The robotic hands can bend and rotate far more than a human hand. This allows more precise surgery compared to laparoscopic surgery. In addition, all of us have a small tremor or a shake in our hands, and this shake is often magnified during laparoscopic surgery because these instruments are long. The surgical robot is able to eliminate these tremors or shakes and therefore makes the surgery more precise. The robotic camera also provides high definition and 3D vision, allowing the surgeon to perform this surgery more carefully. Although robotic surgery has many advantages, there are several disadvantages. One of the main disadvantages is the cost. A surgical robot is very costly. In addition, there are instruments and parts that must be replaced after each surgery, which add to the cost. This cost leads us to the next disadvantage, which is availability of these robots. Very few centers worldwide have these robots. In most countries, any theater in a hospital that has a surgeon is able to do most open surgeries. Most hospitals are also capable of performing laparoscopic surgeries, but very few centers are capable of performing robotic surgery. This low availability also affects training, and not every surgeon is trained in robotic surgery. The other disadvantage is common to both robotic and laparoscopic surgery. Although the surgeon may start the surgery laparoscopically or as robotic, there is always a chance that they may need to convert it to an open surgery because of problems inside your tummy. For more videos like this, you can follow me on my social media channels.